My name is Maura Eaton. I'm a women's health nurse practitioner. Here at Virginia Beach OBGYN, we are happy to provide preventative care for our patients. The Well Woman Visit, commonly known as the annual exam, is recommended for every woman every year. Most insurances cover this important visit with no copay and no out-of-pocket expense. The Well Woman Visit is an excellent time to provide ways to prevent disease. In the past, many women have thought of the annual exam as a time to get your Pap test done, but it turns out you're so much more than your cervix. It's a wonderful time to review ways to prevent disease and talk about lifestyle measures. We can discuss tips for healthy living, including diet, exercise, lifestyle modifications, and safe health habits. It's also an opportunity to review if you are up to date on your immunizations. It's an ideal time to screen for high blood pressure, depression, address any concerns about contraception if you wish to avoid pregnancy, or if you're hoping to expand your family, ways to promote health to optimize healthy pregnancy outcomes. We can screen for and discuss prevention of sexually transmitted infections. For some women, it's a time for breast cancer screening, including referrals for mammograms, and to discuss personal risk factors and family risk factors. It's also a time to provide colon cancer screening and, based on family or personal history, offer genetic testing for certain diseases and prevention measures. For women having menopausal symptoms and going through that change, it's a time that we can review ways to address the symptoms, treat them, and manage them with lifestyle changes or any medications or referrals. As you can see, there's so much we can cover at the annual exam, even when you come in without any additional concerns.
Today, I'd like to talk to you about Pap testing and HPV. You might have noticed changes in the Pap test recommendations in recent years. Traditionally, the Pap test was recommended to be performed annually to screen for cervical abnormalities and help prevent cervical cancer. Scientific research has taught us that the vast majority of cervical cancer is linked to high-risk strands of the human papillomavirus, also known as HPV. Technological developments have allowed us to test women to see if they are carriers of these strands of high-risk HPV. As a result, we are able to identify women that could be at high risk for the development of cervical disease. These scientific developments have led to changes in how we prevent, screen for, and treat cervical abnormalities. The vaccine to prevent HPV infection is now recommended for all young women and men aged 9 to 26. And can be given to women up to age 45. Pap testing is still performed. However, in low-risk women, it may not need to be performed every year. In certain age groups, we now perform co-testing, which means Pap testing and screening for high-risk HPV. Although we still recommend you be seen every year for your Well Woman exam, with these changes, women are now able to space their Pap testing to every 3 to 5 years when normal. So at your next annual exam, talk to your provider about your specific cervical cancer prevention needs based on your age and history. We look forward to seeing you in your next visit.